There, Dr. J here, health tip of the week. Today's health tip of the week, we're going to talk about childhood ear infections. 80% of all ear infections resolve on their own, without a doubt. But the problem is the 20% that don't resolve on their own usually end up on a merry-go-round of antibiotic therapy. And the reason chiropractic works so well with childhood ear infections has nothing to do with the antibiotics. It has to do with the actual tube in the ear. If you look at this model of an adult ear, you can see the tube is slanted down. It's slanted down, pointing to the floor. This is where fluid would drain. Because of that slant, fluid drains out. But when we have a small child, like an infant or a toddler, this tube hasn't developed to slant down. It's more of a horizontal angle with a slight slant to it. So what happens is fluid doesn't flow down as rapidly as it does here, like a slide. It sort of can hang out there. And what can make the fluid hang there? Well, research has shown that when the muscles in the neck are tight, it causes the tube to pull more horizontal so that the fluid will stay in there. So now your child has an ear infection. You take them to the pediatrician. They see that there is fluid there and there's bacteria, so they prescribe an antibiotic. That antibiotic kills the bacteria, the ear infection goes away. But because the tube is still horizontal, because the neck muscles are keeping it that way, you get another ear infection. Then you get another round of antibiotics. And we can keep doing this cycle over and over again. Well, where chiropractic comes in is we actually take the cervical muscles in the neck and we relax them, which allows the tube to tilt. And then that child's fluid drains out and it stops the merry-go-round of antibiotics because the ear infection doesn't come back again. And chiropractic's most successful pediatric cases are with childhood ear infections. And it's not because we're treating the ear infection, it's because we're treating the tight neck muscles, which affect the tube, which then can lead to fluid buildup, which then lead to ear infection. So if you have a child has frequent ear infections, think about going to see a chiropractor.